It is National Women's Health Week, a time to be proactive about your screenings and regular checkups, ladies. And hey, if you don't take my advice, I've recruited a little help to remind you. Grammy award-winning artist Sheryl Crow joins me along with radiologist Dr. Arlene Richardson. Thank you both so much for your time today.
Thanks for having us.
So, Sheryl, you've been a longtime champion for women's health. Why do you think it's so hard for ladies to follow through with doctor's appointments and taking care of themselves in general?
Oh my goodness. I mean, that's the hardest thing. I think most women are like me, and we're super, super busy, and we put things off, especially if it has to do with us. And I always think about the flight attendant who says, can you put on your child's oxygen mask before you put your own on? And unless we take care of ourselves first, everything else sort of falls by the wayside. So in 2006, I was diagnosed with breast cancer from a routine mammogram, and I really didn't want to go to the appointment, and it turned out that I did have invasive breast cancer. I have no family history. I was completely healthy, and unfortunately the statistic is 1 in 8 women now will be diagnosed with breast cancer. And my message is always, until we have a cure, which we don't still, early detection is our greatest weapon. In my particular instance, I was stage 1, so my treatment was very much less invasive than having to go through chemo. So the message is very upbeat and positive, but the follow-through is what matters. Women have to follow through with their yearly mammogram from age 40 on.
I appreciate the reminder, even outside of October, because I feel like we only talk about mammograms and breast health, of course, during Breast Cancer Awareness Month. But Dr. Richardson, since the pandemic began, I know screenings have dropped, and as a result, late-stage cancer diagnoses are rising. So what do you think it's going to take people to get back into the rhythm of regular screenings?
I just want to reassure women that it's safe to come back out and see your doctor and get a screening mammogram today. So if you have put it off for any reason, whether it's the pandemic, life is busy, things come and get in the way, just make yourself a priority. You owe it to yourself. Like Sheryl said, early detection is the key for breast cancer. It is extremely common. And so if you have put it off for any reason, call your doctor today, make an appointment for a checkup, make an appointment for a mammogram. And if you're looking for a mammogram near you, I recommend you visit Genius 3D near me so that you can find a mammogram and put your breast health first.
And real quickly, I know, Sheryl, that you have a new documentary. Congratulations. Can you share a little bit more about it?
I'm really excited about it. At first, I was really nervous. It takes a lot of reflection to tell your story, and I have about 30 or 40 years in this business, thank God. And I wanted to tell the story of a person as opposed to what the public sees. And I have seen a lot in my business. A lot has changed. A lot of things have not changed. And I hope people, if they watch it, will feel inspired and be lifted up and even smile some.
Well, I have no doubt that's what's going to happen. We've been inspired by your music and now this documentary, as well as your personal story. So thank you for being willing to share with us. And Dr. Richardson, thank you for that excellent reminder as well.
Thank you.
Thank you.